Have you ever thought about birth control as more than just a way to prevent pregnancy? Most people think contraceptives are only about avoiding babies, but here's the truth. Hormonal contraceptives do far more inside the body than many realize. They can change your skin, your mood, your menstrual cycle, your weight, even your risk for certain diseases. And depending on how you look at it, that can be both a blessing and a challenge. So the question we're exploring today is, how do contraceptives and hormones affect your body beyond pregnancy prevention? Stick with me, because what you'll learn in this video might completely change the way you see birth control. Welcome back to the channel. If you're new here, don't forget to hit that subscribe button, give this video a like, and share it with someone who needs to hear these facts. And as always, I'd love to hear your thoughts in the comments below. Have you or someone you know experienced side effects or unexpected benefits from contraceptives? Let's get into it. First things first, let's clear something up. When we say contraceptives and hormones, we're talking mainly about hormonal contraceptives. These include birth control pills, hormonal IUDs, implants, injections, vaginal rings, and patches. All of them work by delivering synthetic versions of the hormones estrogen and/or progestin into your body. These hormones are powerful chemical messengers, and they don't just affect the ovaries. They influence multiple systems in the body, from your brain to your skin to your bones. So beyond pregnancy prevention, what else do these contraceptives do? 1. Menstrual cycle control. One of the biggest non-contraceptive benefits is cycle regulation. For many women, hormonal contraceptives bring shorter, lighter, and less painful periods. In fact, doctors often prescribe the pill to manage conditions like heavy bleeding, endometriosis, or irregular cycles. Studies show that women on hormonal contraceptives can reduce menstrual blood loss by up to 90%. For someone with anemia caused by heavy bleeding, this can be life-changing. 2. Skin benefits. Acne reduction. Did you know that certain birth control pills are actually FDA approved as acne treatment? That's because estrogen and progestin can reduce the levels of androgens, those male hormones that trigger excess oil production in the skin. With less oil, there's less acne. Many dermatologists use hormonal contraceptives as part of acne treatment plans for women who don't respond to topical products alone. 3. Protection against some cancers. Here's something fascinating. Long-term studies have shown that women who use hormonal contraceptives have a reduced risk of ovarian and endometrial cancers. According to the American Cancer Society, using birth control pills for 5 years can cut ovarian cancer risk by nearly 50%. And this protective effect lasts for years even after stopping the pill. That's a massive benefit many people don't know about. 4. Relief from PMS and PMDD hormones in contraceptives can stabilize the big swings in estrogen and progesterone that cause premenstrual syndrome, PMS, and its severe form, premenstrual dysphoric disorder, PMDD. Women who suffer from mood swings, bloating, or painful cramps before their period often find major relief on hormonal contraceptives. But of course, it's not all good news. Let's look at the other side of the story. 5. Mood and mental health. This is one of the most debated areas. For some women, hormonal contraceptives improve mood stability. For others, they can trigger depression, anxiety, or irritability. A large Danish study in 2016 found a small but significant link between hormonal contraceptive use and the prescription of antidepressants, especially in teenagers. The bottom line? Every woman reacts differently, and paying attention to mental health changes is crucial. 6. Weight changes. You've probably heard people say, the pill makes you gain weight. But is it really true? Research shows that most hormonal contraceptives do not directly cause major weight gain. However, some methods, especially injections like Depo-Provera, have been linked to increased appetite and weight gain in some users. The pill and other methods for most women don't cause large changes, but individual responses vary. 7. Blood clot risk hormones affect blood clotting factors. Estrogen-containing contraceptives, especially pills, patches, and rings, slightly increase the risk of blood clots in the legs or lungs. While the overall risk is low, it's higher in smokers, women over 35, or those with certain health conditions. That's why doctors carefully screen women before prescribing. 8. Bone health. Here's a surprising one. Some contraceptives, like the Depo-Provera injection, can reduce bone mineral density over time, especially with long-term use. The good news is, this loss is usually reversible once the contraceptive is stopped. On the flip side, estrogen-containing methods may actually help protect bone density in some cases. 9. Libido and sexual health hormones can affect sex drive. Some women report an increase in libido because they feel less stressed about accidental pregnancy. Others report a decrease because of changes in hormone levels. Vaginal dryness can also occur in some cases, depending on the method. Again, it's highly individual. So we've seen both the good and the bad. But what does this all mean? It means hormonal contraceptives are powerful tools. They don't just prevent pregnancy, they reshape hormonal balance, influencing multiple areas of health. And like any powerful tool, the effects can be positive, negative, or mixed, depending on the person. Now here's something important. Doctors often prescribe contraceptives for non-contraceptive reasons. A teenage girl with severe acne may be put on the pill. A woman with endometriosis may be prescribed a hormonal IUD to reduce pain. Someone with unpredictable bleeding may use contraceptives to stabilize their cycle. These benefits are real and scientifically supported. But at the same time, if you're experiencing side effects like mood changes, headaches, or loss of libido, it's not all in your head. Hormones are real, and your body is responding. That's why it's always important to have open conversations with healthcare providers. Sometimes switching methods, from a pill to an IUD or from one pill formula to another, can make all the difference. So let's answer the big question. How do contraceptives and hormones affect your body beyond pregnancy prevention? The answer is, they influence almost every system in subtle or dramatic ways. They can improve your skin, regulate your periods, reduce cancer risks, and ease PMS. But they can also affect mood, libido, weight, and clotting risk. Ultimately, hormonal contraceptives are not one-size-fits-all. What works beautifully for one woman may cause side effects in another. That's why education is so important, so you can make informed choices that fit your lifestyle, your health, and your personal goals. Before we wrap up, I want to hear from you. Have you experienced any unexpected benefits or side effects from contraceptives? Drop your story in the comments below. Your experience might help someone else. And don't forget, if you found this video useful, please like, share, and subscribe for more deep dives into health and wellness topics. Hit the notification bell so you don't miss the next one. Thanks for watching, and I'll see you in the next video.